Welcome to the Human Connection webinar. I'm Becky Swanson, Division Director of Marketing for Hospital Sisters Health System Western Wisconsin Division, and I am here with my colleague,
Mardy Maki from HTK Marketing. I'm a Senior Strategist.
And we're going to talk for the next bit of time about a campaign that we've been doing for, I came up with this
about 2 years ago.
2 years ago, and have continued it to much success. Human Connection series, and it started out of a thought that I had about the time people have to connect in healthcare these days. It certainly is a completely different pace than we used to have. Across the country, we're now worried about metrics like average FTE per average occupied bed, EMR usage, productivity. Years ago when I started in healthcare 30 years ago, we weren't thinking about those things, and physicians and nurses had the chance to really create a connection. But there's so many other things going on now. The pace is so different in healthcare that window to connect is so much smaller. And we know, and we'll talk about that too, the statistics show that people want that connection. So what do? We decided to go to video and to use this. Now, this is us. We're here in the Western Wisconsin Division of Hospital Sisters Health System. Hospital Sisters is a system here in the Midwest, hospitals in Wisconsin and Illinois. In Chippewa Falls, we have St. Joseph's Hospital, in Eau Claire, Sacred Heart Hospital, together about 500 beds. But as hospitals these days, we are not just those two buildings. We have lots of other outreach, outpatient, rehab, AODA, behavioral health, many other things going on. You can see to the west of us is Twin Cities, high quality healthcare happening there in Minneapolis and St. Paul. Just south of them, another very iconic spot here in America, certainly in the Midwest, Mayo Clinic, delivering, again, very high quality healthcare. In further south in Wisconsin, Madison, Milwaukee. So we're surrounded by other caregivers, other folks who are delivering high quality care. So although our towns are not huge, it's still fairly competitive. So the time gap, I talked a little bit about that, patients are craving attention, and physicians are as well. And this is from a Harris poll, 2,300, just over 2,300 general population. And it came up with some pretty interesting statistics. This happened between September 9th and 7th last year. Many factors contribute to the experience in a doctor's office. Doctors' overall knowledge, training, expertise top the list. But a majority of folks also rated the time spent with doctors. 58% said that was very key to their satisfaction and very important to them. And other things were on the list, being able to email the doctor, those sorts of things. But over half the people said time spent. So this was an interesting thing. To get 8 minutes is the amount of time that each provider is able to spend with a patient. So, contrast it to, again, 30 years ago, 30 minutes was pretty easy with a physician, 20 minutes, and now 8 minutes is about all that is.
And we know there's even a greater time crunch, and depending if you're in a rural market or urban, depending on the patient panel size, that time is fluctuates accordingly.
So. Oh, absolutely. So so there's a lot of overcrowding for our primary care physicians, and this statistic, I'll admit, this one confuses me just a little bit. But here's what it is if the physicians had the opportunity, and Marty, correct me if I'm wrong, if physicians had the opportunity to spend as much time as they wanted with each of the patients that they see every day, they would have to spend 21.7 hours a day only seeing patients.
Right.
So I'm believing that on the primary care level, our physicians are a little frustrated by that. We certainly know that patients are frustrated by that. This is data from Annals of Family Medicine article from 2012.
So then we look at what's happening in the care setting, and then we transition to, well, what's happening in our lives as consumers, as individuals. What has become a powerful way to connect? We know there's an important human connection that needs to happen in a healthcare setting, but outside of that setting, we know that it's important to spend time together for us to feel connected to others. And for, this statistic is based on from Pew Research, and that 44% of patients go online to research their doctor. And we know that statistic is higher based on the demographic.
Well, and higher too, because more and more people are coming out with physician ratings.
Yes. I think of Yelp.
Yelp, just
exactly. That's going to put it in everybody's pocket.
Your restaurant and your physician. So if you meet your physician at a restaurant, then you can really get that figured out very well.
Absolutely. So everyone's looking online, and then this is published by the advisory board company Sharp Healthcare in California, had looked at engagement on their online, and when they included video physician profiles, they found a 3 times more higher engagement with those videos versus the static content that they had in the past, whether it be just the text biography or even a photo, but 3 times more engagement when it comes to using videos. So.
And that just makes sense. I mean, you think about the people you go to, and not as vital as healthcare. I have to say that if my hairdresser had a video online talking about how she approaches and what she does, heck yeah, I'd go see that person. I mean, you think about all the people in your life that provide a service to you. I'd be more engaged with video. So it makes sense that the physician engagement is higher as well.
And then there's a science behind it. There's some great study published by Susan Weinschenk, a PhD. She's also called the Brain Lady. And she's a consultant to Amazon, Disney, big brands, and has found that the reason why video is so powerful is because we are hardwired as human beings to respond to the human face, to another face. It's a gathering point of information for us. When we look at somebody's face, we read them for believability, and we also listen to their voice, the inflection in their voice. What is the meaning of what they're trying to convey? Is it truthful? And we also look at body language, nonverbal communication. These are so important to developing that connection and believability. And also movement, of course, grabs our attention online, and that's why we see more and more movement and the use of video. So that's some of the science behind why video is so powerful. And then it's ultimately about that human connection. We need to see somebody. We need to see their face, their eyes, and listen to their voice and see, is that somebody that we would want to spend more time with? People also love video. Statistics are showing that in the Syndicast trend report, 74% next year of internet traffic is projected to be video. So video is driving internet content and interaction. And even looking back at last year, in Facebook's earnings report, they've reported that between April and November of last year, they doubled their video views. So from 4 billion to 8 billion. Significant response. And Google rewards video. Your chances of getting a page 1 listing on Google increases 53 times with the use of video. So we know that it's being rewarded when we include this kind of content online.
So video is king.
Yes.
In watching video, I think as we've shown, we become immersed in it, we identify with the people, we create that connection. And so video was was where we knew we needed to go. So what we did is let me talk about this. 1 minute of video is worth 1.8 million words. That's I can't imagine 1.8 million words. I've probably said that many in some boring conversation. Forrester Research, James McQuivey, this was published in Forbes. So what we decided to do was we decided that we would talk with our frontline caregivers. These are folks that, when you're sitting in the cafeteria or you pass them in the hallway, engagement conversations, some of the most amazing stories come out. And as a marketer, that is it's rewarding to get those stories, but as a marketer, it's somewhat frustrating because, there's probably, for every one that we hear, there are probably, 80,000 more out there that we're not hearing. Yeah. And I think frontline caregivers don't understand how amazing they are and how they are changing lives every day. It's what they do. And they see it as just what they do. Certainly as an outsider looking in, I think we all see that as pretty amazing. So the frontline caregiver, this is the person that our patients spend most of their time with when they're in our hospitals, in our clinics. So that was what we started with. So we wanted to help creating that connection of when somebody walks in the door to any of our facilities, that they might see a face that they already know a little bit about, a face they've already seen on video, digitally, web, however we're going to be using it. So what we did was we used a very unscripted approach. We're going to show you a few of the videos in a minute. Unscripted approach so that we had that very conversational, a very real message. And I have to right now give a huge shout out to Mike Schultz, who works here at HTK, because he is an absolute genius at getting those conversations started.
And I just have to share one little tidbit, and that is when people were asked to participate in this effort, again, like Becky said, they don't naturally want to just tell their story. This is what they do every day. They kind of take those heroic efforts for granted on their part. And Mike just has such a knack for bringing that out in them to be conversational, to just share their story in such a relatable way that we found as we went through this process and came back for another shoot, more and more people asked to be a part of it because they felt so connected to their own story, and he just drew that out of them. So anyway,
the first few people that came were sort of like, going to the firing squad. My boss made me come and to do this. And what we found though was, we'd ask, director of rehabilitation or cancer or heart to, send us three folks, pick your extroverts so that they're not so far out of their comfort zone. And what would happen is they would go back to their unit after they had done their brief interview, and we would start getting phone calls. The director would call and say, I've got 2 more people that said that they have time to come down today. So and down, we're doing it in one of our lower level conference rooms. So then it started the traffic, and people really started to enjoy the process and understand that it wasn't at all painful. So we had an outline of questions, which is some idea of where we wanted to go with this, but we also would follow the conversation where they took it, and it often went in very different directions, because ultimately what we're looking for is their story and ways in which they connect with the people that they care for. So, on the screen, you'll see we've got lots of things up here: empathy, understanding, challenge, inspired, joy. Joyful joy is one of our core values at Hospitals Sisters Health System. So something we talk a lot about, hopeful, passionate. So Mardy and I are going to be quiet for a minute. And so just sit back and see a few of the videos that we were able to put together.
My name is Debbie, and I'm a nurse in the emergency room at Sacred Heart Hospital. Well, the reason I'm wearing a hat today is that I too have been on the patient side. I had cancer, and I went through cancer treatment, and part of that treatment, as most people know, you lose your hair, and it really has opened some doors to relationships and helping patients better. One particular night, I walked into a room. This lady, it was kind of the end of my shift, and I was going to leave, but they were really busy, and it was somebody with a headache. Well, headaches are pretty straightforward. Start an IV, give them some meds, etc. So I thought, well, I'll just pick her up quick before I go. So when I opened the door to her room, I saw a lady laying in the bed who looked just like me, only I had my wig on. She had little to no hair and a little bit of stubble. And her daughter was at the bedside, and she was like really advocating for her mom because her mom had just found out that she had metastatic cancer to the brain and was having severe headache. And as I looked at them, I just simply took my wig off. And I said, I understand. And the lady put her arms out and she gave me a hug. And on the walls of Sacred Heart, it says, there is hope here. And that lady and that family knew there was hope there. And I was able to give it to them because they could see that I'm back in the game of life again. And that gave them hope.
Well, my name is Shauna Lee. I'm an audiologist here at Sacred Heart Hospital. I work with people to meet their hearing and balance needs. I became interested in audiology once I entered college, but it's been really near and dear to me my entire life. When I was 9 years old, I was fit with my first pair of hearing aids, which was a somewhat traumatic experience for myself, for my mother. I dealt with hearing loss in my family for many years. We have a genetic predisposition to hearing loss, and that piqued my interest, so to speak. And once I started studying communication sciences and disorders at the university level, I decided that that was where I wanted to be. So my hope is that my story will help people, inspire people to get help sooner and to realize that the stigma that we think is there with hearing aids and hearing loss is actually lessened by some of the treatments that we have available. So we're really trying to squash that stigma and keep people motivated to hear better and live better. My name is Kelly, and I am an adult nurse practitioner in palliative care service at Sacred Heart Hospital. Palliative care is a form of specialty medicine where we like to try to establish care with any patient and their family who has been diagnosed with a chronic or terminal illness. I hope to be that person that can sit, talk, explain, help them look ahead a little bit. I never like to hear the phrase, there's nothing more we can do for you, because we can always provide comfort. One of my big things as a parent, as a therapist, just as a person in general, is to limit screen time. Too many kids are plugged in way too much, and that is not helpful for brain development. Kids should be touching, playing, getting into things instead of sitting and being entertained. Long-term development, I don't think that's good for kids to always be plugged in. So if you're a kid, your job is to play. My name is Lindsay. I'm the director of the orthopedic surgical unit at Sacred Heart. My mom is a nurse, and my dad's a teacher, so it's sort of ingrained in you, this desire to make the world better. It's always been about people, helping people become well and lead better lives and those kind of things. People, when they have one knee done and then they come back for their second knee, and they're telling me how good it is, and how their quality of life is improved and things like that. And that's what's so enjoyable about the whole idea of orthopedic joint replacement surgery, is giving people hope, and giving them something that they can look forward to, and having less pain in their lives. So that's what I love about it.
When I talk to my patients about laughter, Laughter is one of the best medicine physiologically. We use the most muscles in our face when we laugh. Laughter is a form of exercise to use your facial muscles. And if you're happy in your mind, your body will be happier and healthier.
Hi, my name is Nadine. I'm a physical therapist at Sacred Heart Hospital. In high school, I knew I wanted to go into the sciences. And I realized very quickly that I would not be happy working in a lab, that I really wanted to work with people. I enjoy talking with people. I enjoy learning from people. I enjoy interacting with them. I enjoy being a part of their life. There are those moments when you're working with people when the light bulb goes on. I very much enjoy seeing that in people. I enjoy helping people, and I enjoy seeing them feel better or realizing that there's some hope, there's a solution out there. Together we're going to figure this out and we're going to get you back to doing what you want to do. My personal mission is to be able to treat everybody that walks through the door the way I would want to be treated, or the way I would want my family member to be treated.
I'm Jill Gwynn. I'm a nurse here on the OB floor, so that's the 3rd floor. I work with the mamas and the babies. It's my dream job. When I did a rotation in labor and delivery, I sat in on my first delivery, and I was just this little nursing student in the back of the corner of this room, and this mama had her baby, and I'm just bawling in the background. And at that moment, I knew, I was like, oh my goodness, seeing this miracle every day, I knew I wanted to be a labor and delivery nurse and postpartum, and so it is literally my dream job. If moms come to Sacred Heart, they can know that they're going to be loved and they're going to be cared for, and that everyone on our staff is going to do everything that we can to make their experience wonderful and beautiful and special for them and their family. You know, miracles are happening on our floor every day. Every day. It's so cool to be a part of it, and it's someone's most tender moments and most special moments, and they're going to remember you for the rest of their life because that's when they had their precious little baby. So my patients, I mean, they are amazing.
So those are the amazing people, just a few of them that we talked to. And another side benefit, you know, the thing is that this is like this sort of thing that we keep finding new things about this whole process and what we're doing. And one of the things that came out of it is that our colleagues became so much, they were engaged in the process. They loved seeing each other do it, seeing it on Facebook online. They were proud of each other. So
to take
that's
a
fun.
moment out of their day to step back and look at, why do I do what I do? Why did I choose this career? And I think that really kind of reignited the passion they have for their jobs too.
Absolutely. And, you know, you can see from the statistics, the engaged employees, they've got enthusiasm, they're inspired, they're confident, 5 times higher engagement level of employees who experience positive versus negative emotions. That engaged employee is going to be the positive person that somebody meets walking in the door. And that's, you know, obviously that's what we want. This is, we've done another shoot. I say photo, I say video, it's all digital, whatever. Like I said, I've been doing this a long time, when we used to do film. And some of you are going to have to Google that and look that up. We've had 60. We're editing a whole bunch right now. We'll end up very shortly, by the end of the month, we'll have 90 of our colleagues that we've talked to that have told us their amazing stories. Rehab, OB, palliative care, you know, and that was it. When we started this, we kind of prioritized what departments we were going to do. And we wanted those where people spend time and they do have that relationship. And we know that in OB, I mean, I so very clearly remember the nurse I had when my son was born 37 years ago. You remember those people. So OB was one that we targeted initially. Rehabilitation, you saw several folks from rehab talking because they do spend time with people. So now folks have the opportunity to go online, go onto the website, see the people on the rehab team, and kind of have a virtual knowing of that person.
And also one thing that we've talked about in this process too is that now with so many of, if it's like a baby boomer or someone from the silent generation, and their children may live in California or other places, and they're able to go online and see who is going to be caring for my mom or dad. And I think even just that, being able to engage even beyond the direct service area, but even with other family members that may influence the care decision. So that was just another thought too.
Yeah.
So when we look at these stories that we've captured, and we've had so many different uses for them, everything from the Go campaign, which is all about health and wellness, to just service line specific. And so we just have a quick example for you to show how we would even say that we had 2 interviews with St. Joseph's nurses, OB nurses. And in St. Joseph's Hospital services a community of about 63,000 people. Within that, our target demographic for the OB or the birth center was, around 11,000 women, 18 to 34, without children in the household. And
now, let me jump in. We were able to segment that out, and our thought was at that time that if we could target women without a presence of children in the household, these are women that probably have not set their pattern of where they're going to go to have a baby. So felt that was as fertile a soil as we were going to find.
So in looking at even social media, again, we had these 2 interviews, 15-second, 30-second versions that we used in a digital campaign and social media. You look at the impact. Again, we're targeting 11,000 people in our target, 262,000 views with an average completion rate of 28%. In comparison, Facebook, good completion rate is around 15%, and for YouTube around 10%. So we have high engagement, high completion because of the believability and just that emotional connection that can be created through these stories and these videos. When we look at YouTube minutes, in 2015, the entire year, there were about 17,000 minutes of viewing. Just in the first 5 months of the campaign, or 5 months that these videos were on now, that's after a digital effort. Then we had organic search that would find these videos. And so, 58,000 minutes viewed, just a significant increase. Looking at overall YouTube views, increased by 50,000. So from year. And again, that was through the end of June or beginning of June. So great response. Then there's the qualitative. It's when people see that was a nurse that helped me when I had my baby, and they're making comments and sharing with their friends, and then you have other coworkers that are proud of the organization. Just the positive sentiment that these videos generated in social media was wonderful, and it was really great for these employees too.
Yeah, and so as employees became more engaged, as I said, even if they weren't the person on the video, they were so proud, to see Elizabeth, who they work with, or, who they've known because they've all worked there together for a while. It just, the sort of engagement thing just kind of kept moving out, just with our colleagues as well as with the public.
Yeah. And again, just great comments. The hospital is blessed to have you, so our patients. For someone that had a great experience there to say, they gave me the best possible care. So again, it just creates this opportunity for more interaction, connection, and sharing of good things that have happened in the care setting. So some of the takeaways are just, again, that videos are so powerful. These are stories. We kind of took an organic approach to the start, in that we knew there was a lot to capture, and we wanted to take that opportunity. We do want to ask, if you have any questions, we are available to answer some questions.
Yeah,
and
yeah. Send us your questions. One of the other things too that we've realized with this video, and it's kind of been the focus of some of our marketing budget dollars, is that we've as an aside created this amazing continuity because we've got all of this amazing raw footage. And so we'll edit it for a commercial, and then we'll have the 15, 20, or 30-second ones edited for online. And then we'll get a last-minute request for we had one last year. We need a video for the board dinner. So, okay, yeah, we've got all this amazing content. So let's edit this and show our board of directors, the folks that they're working for, the folks that they're helping do their jobs. So the fun thing is that if you're online or you're on Facebook, or if you see the video at a conference or at a meeting or whatever, all of a sudden we've got this continuity of message that's just happening. The other thing, and you saw when we ran the videos, we had a couple that were about Go. Go's a campaign, I think Mardy said, health and wellness. It's a campaign that we've been running, Go 15. We just want people to go an extra 15 minutes today than they went yesterday, because we know movement is so important in health. It was one of the questions we had to ask people about, and they said some amazing things. So now we've got this whole part of the campaign that we can focus to Go. We have some online health screenings, and some of the nurses have talked about that, about how important it is to just know your numbers and know where you're at. So then we have a campaign that's forming for that as well. So lots of offshoots on all of it by having the thoughtful process at the beginning.
Yeah, definitely. And so we would be happy to answer any questions that you have. Feel free to just respond to the email that you received for this webinar. We'd be happy to answer them. You can connect with us on LinkedIn or call us. Phone number is 218-269-6067. But yes, please keep in touch. Let us know if there's anything else we can answer for you.
Yeah.
Thank you.
Do we have the other screens?
We have.
Sorry, we've got a little technical difficulty here. Because the presentation you just saw is also an infographic. So if you liked what you saw and would like to have your own shot at printing that out or getting a copy of it, htkmarketing.com/Atlanta is where you can get to that infographic. This was a presentation that Mardy and I originally did at a conference in Atlanta, so that's why it says that. But it is an infographic that you can access.
Yeah.
So please contact us if you have any questions, comments. We'd be happy to hear.
Yeah.
We'd be happy to hear your story, because that's what we're all about, is
Yeah.
hearing the story.
Thank you for joining us, and we'll see you soon.